Now we will talk about the major discovery for this research. Candida albicans is the most prevalent species linked to VVC. API20C AUX was the most accurate phenotypic technique for correctly identifying the majority of Candida species, whereas PCR-RFLP was the most accurate genotyping method. The hypothesis of this research: the majority of cases of vulvovaginal candidiasis (VVC) are caused by Candida albicans. However, episodes due to non-albicans species of Candida appear to be increasing in immunodeficient as well as healthy women. Most important is the objective of this research. This local study was conducted to identify the spectrum of Candida species associated with VVC using different phenotypic and genotypic methods and assess their antifungal susceptibility pattern.
Next is about the main method that is used in this research article. The first one is phenotypic identification of Candida species. This method is used for the isolation, cultivation, and maintenance of the Candida species. Besides that, it is also to identify the Candida species by observing the colony morphology and comparing between them. SDA is used to grow non-pathogenic and pathogenic species of fungi and yeast. Next method is the PCR-RFLP method. PCR is used in molecular biology to amplify small sections of DNA origin. PCR-RFLP that is used in this study enables the identification of 6 medically important Candida species which represent up to 95% of Candida infection. Last is the antifungal susceptibility testing, which is to provide in vitro measurement of the concentration of an antifungal agent that inhibits growth of a given fungal organism. The minimum inhibitory concentration, hence drugs with lower MIC scores, are more effective antimicrobial agent. In this research, antifungal susceptibility testing is done by using this diffusion and Roth dilution method.
The first major result in this study is the phenotypic identification. One of them is the colony morphology on SDA, where the shape, size, color, surface appearance and texture differ from one species to another. For example, in this study, Candida albicans has convex dome shape and pearl-like colonies, while Candida cruzi has irregular colonies with mycelial fringe. Other phenotypic identification in this study are germ tube test, subculture on rice 2080 agar, and few more. Next is PCR-RFLP. As we know, PCR is used to amplify the small section of DNA origin, and the amplified PCR products were run on agarose gel electrophoresis and observed under UV transilluminator. The results are as shown in this figure. There are distinct bands from range 510 to 870 base pair obtained from isolated Candida species. However, only Candida glabrata in land 4 and Candida guillermondi in land 7 can be distinguished from other bands of isolated species. Hence, PCR-RFLP analysis, the most common method used for identification of Candida species, was carried out using recession enzyme MSP1. As shown in this figure, the Candida species can be distinguished from each other. For example, land 5 Candida albicans have two bands that can be observed at 238 base pair and 297 base pair. In this study, this diffusion method is used for antifungal susceptibility testing. There are 6 antifungal used in this study. From the result, amphotericin B was the most effective drug against vaginal Candida isolates, which is 98.4%, and the least sensitive is miconazole, which is 50.8%. Other than that, in this study, there is no Candida isolates resistant to ketonazole, clotrimazole, and miconazole. Another method that can be used to test the antifungal susceptibility is Roth dilution method. In this method, certain concentration of antifungal agent are added increasingly to the liquid medium, which is inoculated with a standardized inoculum of the test microorganism. The advantages of this method are multiple antifungal can be tested at once, and this method is highly accurate compared to the diffusion method.
Based on the result and discussion, API20C AUX was an effective phenotypic method for Candida species identification, whereas Chrome ID Candida agar was a great approach for the identification of presumptive Candida albicans. Meanwhile, the PCR-RFLP analysis proved to be the gold standard due to its potential, but it still requires further research for a more rapid diagnosis. Furthermore, antifungal susceptibility testing is necessary to avoid any misdiagnosis. Hence, we are agreed that these molecular techniques could provide a faster and more accurate alternative compared to conventional methods. Plus, to support this conclusion, the authors stated that they have no conflicts of interest with other researchers or findings.
Next is the limitation of the research. One of the shortcomings is the lack of differentiation between C. albicans and the closely related species C. candidiasis. These species are highly related pathogenic yeast species. However, the method used for species identification in this study were unable to differentiate between them. Hence, there's a possibility for the culture C. albicans to be C. candidiasis in this study. Furthermore, the limitation of this research also included the use of PCR-RFLP for the identification of clinical Candida isolates, rather than using it directly on a clinical specimen. This means that in this research, for the PCR-RFLP to achieve its purpose to identify 6 medically important Candida species, it needs sample that is the Candida isolates, which is possible through the culturing of clinical specimen to this SDA bed. This method will not succeed with the vaginal swab specimen from the patient. Hence, more time is needed in the preparation of doing the PCR-RFLP method.